Hey guys, how's it going? Um, it's Nikki here. I'm checking in 1 week post MALS surgery to let you know how it went and maybe give you a little bit about what to expect if you're going in for that. Um, I use the team at UC Denver, and for the most part, I just felt like I was really well cared for. So many people came and talked to us before the surgery. We were kind of laughing. It was like this parade of people, and I think it's not a surgery they do every day, so they were a little extra excited. And they're teaching hospitals, so they come with extra people um, who are all just sort of bright-eyed and bushy-tailed. Um, the anesthesiologist was particularly accommodating. We had had a discussion with another doctor regarding the fact that I've been feeling with each subsequent surgery that I'm having some difficulty with post-surgical depression and brain fog and so forth. And this other physician had recommended that, maybe talk to your anesthesiologist about Versed and the use of it and the fact that maybe they could skip it or use less or something like that, because that seems to be the drug that could be involved with that. I don't know if that's the case, but I thought I'd have a discussion with him, and he was like, "Yeah, I'm open to that." He said, right, basically, Versed is there to keep you from getting anxious going into surgery, and yes, it is anxiety provoking. I'm not gonna lie, um, but we agreed that we just go with half. Um, and he checked in with me right before they put me under as well. Are we still good with that plan? Yes, we are. So, and they wheel you in, and there's like, nothing. If you've never had a surgery, you don't know what it looks like in the back of the hospital, right? Where there's like, or if you've never given surgery or been, if you're medical staff, you know this shit, but there's like tons of these incredibly bright square lights in these hallways that just look like they could go on forever and they belong in like the CIA or something. And then they wheel you into this room that has even brighter lights and more lights and beeping things. And everybody that you just met that seems so friendly a minute before is like wearing a mask, and they're looking at you like, here, let me put this thing on your face and you won't be able to breathe. So it is very anxiety provoking. I'm not gonna lie. But it comes with, I'll talk a little more about this in a bit, but the wizardry of it, the miracle that is surgery, and the fact that you don't have to experience it awake and aware. It's amazing. Um, so we had a little talk. Finally, had a talk with the surgeon. He was the last person to come in. I think he was running a little behind, and Colin and I both remember that he said there would probably be 3 incisions plus a 4th larger one. Um, a little alert here. I'm going to show you my belly. I count more than 4 holes here. Do you? I think I count 7. So I know I had a discussion with a one of the post-op doctors who said that all she could tell me is that one of those was in order to hold my liver. And I looked at the report, and it said that there's some mechanism by which they do open you up and like hold your liver, and then they attach that to the rail on the bed somehow, I guess, to get it out of the way. But that doesn't explain 7. So I will have to have a discussion with Dr. Chauhan about that. I'm very curious. And in recovery, I spoke with a nurse, and I just asked, is it this rough for everyone? And she said, everyone really varies, but she said, I'm recognizing that you have more holes than most. So again, not sure what standard, not sure how this works, but it's robotic laparoscopic surgery. So pretty fancy stuff, very skilled stuff that's happening. So I don't question that it was right. I'm just a little curious. Um, the first night in bed was very painful, and I am still a little curious about what exactly happened. The surgical report says that, by the way, yes, the celiac plexus did not look right, and I forget the exact words they used, but yeah, it needed to go. And the report also says that the the Foley cath came out before I did out of operating, but that is not true. I woke up fully catheterized, and the last surgery I had, the catheter was, wasn't particularly comfortable, but, this was in Providence for the tethered cord surgery, and I could roll from side to side, um, and it was fine. But in this case, I was on a very narrow bed, and it was, for some reason, the nurse insisted that the bed had to be tipped this way because I needed a pillow between my legs in order to sleep. And she was like, well, that's going to tip it back, so it's going to flow back into you. So now I have to tip the table this way. And when the tables there tilt that way, they do like a weird thing like this. So there's like a dip right where I needed support, right where my back was just killing me. My MALS pain is typically from here to here, and I've described it as a broomstick that like is twisting, and it feels like it takes all my fascia with it. This pain just felt, I was like, I wish I hadn't used that descriptor, because now it literally feels like I'm impaled. It was so painful. And I felt like she did her best to control, she being the night nurse, to control my pain, but it was just rough. I didn't really want to take anything by mouth. I was feeling sick. I never puked, but very close. And, there's only so much she could do with, IV meds and whatnot. But I still, and the other thing, back to the catheter, she told me that I can't lay on my left side. I had to lay on my right side or on my back, or else she'd have to like completely rehook up the catheter. And I just don't get that. I really am going to have a discussion with someone about that, because it could have been so much more comfortable, I think, without a catheter together. Or at least, I don't know, did they need a longer one? I was so out of it that I really didn't have the wherewithal to question this whole thing. But yeah, I didn't need all of that in addition to what was going on. The next day, surprisingly, they released me, and very quickly. It only took like a half hour to release. And I was feeling well enough to go, and my pain levels were under control at that time. In the car on the way home, I put a piece of ginger candy in my mouth just to like make sure that I don't feel sick, and immediately had to spit it out because for some reason my teeth are incredibly sensitive. Something to do with anesthesia, very vague. I don't know how to explain it, but my teeth have remained sensitive, gradually getting a little better every day. Never heard of that side effect, but I literally cannot chew anything sweet this whole week. Not that I wanted to eat much, but as far as I know, the surgery was a success. That night I went to bed and I woke up at like 6 o'clock in the morning. I was like, ooh, wham, pain. Okay, so we're gonna have to get serious about some drugs. I think I took, I don't know, some oxycodone or something. And it just wasn't touching it. And that was a little concerning to me. It just didn't seem to be helping. And it was largely this pain in the back, but it was over the next couple days, it would kind of migrate front to back. And it felt like I had a really terrible stomach flu crossed with salmonella poisoning, crossed with this broomstick. Except, when you have the stomach flu, you get that break between, when you're puking and you're not. And it was the kind of pain where you can't think about anything else. I was nauseous, I was shaking. And the confusion for me is I couldn't tell whether the pain medications were making it worse or making it better. And I think this might be a really important distinction for everybody who has the surgery. It's an abdominal surgery. And I know that I have a history, and I think many of us do, of like NSAIDs causing stomach upset and opioids causing stomach upset. And dude, my stomach felt very much like when I was in Iceland and I had given myself little tiny ulcers and like inflammation in the stomach from taking too many NSAIDs. It felt an awful lot like that. So I'm sitting here thinking, should I take more meds or less meds? I don't know what to do. So I finally called the doctor on call, and she said, the pain you're describing, I think, sounds to me more like it's not from the medications. You have, she explained to me, I had a major surgery. There's lots of different kinds of pain. One of them is nerve pain. And as soon as she said that, I thought, gabapentin. And she said, you have some on hand? And I was like, yes. She said, if you have it on hand and you're comfortable using it, you might want to give that a try. And I did, but that was like 3 days later. That was 3 days after like writhing in pain. I just couldn't get it under control in other ways. I had a few hours of, sleep and whatnot. So note to anybody who is having this surgery, consider getting a prescription of gabapentin ahead of time, because it is a nerve analgesic. And there's a lot of nerve pain involved with this. They are cutting your nerves. So that finally got it under control, and I felt so much better after that. But meanwhile, I felt pretty sick, and it was really hard to eat. Really hard to, I couldn't stand for more than like 30 seconds. I would just have to come back down because it was so painful. The only comfortable places were kind of on my back and on my right side. I still can barely lay on my left side for some reason. And I talked to another patient who had the same surgery on the same day I did, and she's having trouble on both sides. And it just kind of, I have sort of almost like a tearing feeling viscerally when I try to do that. So just be prepared for that. I don't want to scare anybody. I hope I'm not scaring you, but just, be prepared. It's not a little tiny prick. Let me see. I'm going to look through my notes here and make sure that I'm not missing anything. Yeah, and meanwhile, the people on the MALS PALS website were just so helpful. And one comment that I think really kind of helped me put it in perspective was that her doctor advised her not to judge the surgery for at least 3 months. I think that's totally reasonable. Maybe you think you did the wrong thing. And there were moments over the last week when I thought, is this my SMAS pain? What have I done? What on earth have I done? Because this is, that sort of right-sided, I felt really full all the time. And I thought, oh God, did the MALS surgery just exacerbate my SMAS? And I've just gone into this other land where now I'm going to have another abdominal surgery that I've been trying to avoid. And I've done, I feel like, a really good job somehow over the course of my life. I don't know if I have any physical control over this, but I have somehow managed to minimize my SMAS symptoms, I think, by some weight gain. Somehow menopause helped as well. Menopause also helped with weight gain. I have been thinking I can get away without that surgery. So it just, in the midst of pain and all of that, I had this, very fearful thought. And I think now that is not true at all. So other things that came up in the report, it says I'm very pleasant. I like to think that I am. It says a harmonic scalpel was used, and I'm fascinated by this. What is a harmonic scalpel? I looked it up. It's a surgical instrument used to simultaneously cut and cauterize tissue, and it uses ultrasonic energy to do this. So I don't know. Wait for my next album, perhaps I will call it harmonic scalpel, because I just love the word. I also love this. To enable retraction of the left lobe of liver, a Nathanson retractor was placed in the subxiphoid location. The Nathanson retractor was then anchored to the operating room bed using a laparoscopic instrument holder. So my liver was literally anchored to the bed. Some people, you don't want to read your surgical reports. I'm just naturally curious, so I wanted to know. How am I feeling? I'm feeling very calm, and I don't know if that's, I've had several days of drugs. Today I haven't taken anything, and today is day 7 after the surgery. So if that gives you some idea. But I do wonder if the reason I'm feeling so calm is this. Only time will tell, but I've heard other people say after their MALS surgery, they feel so much more calm, that there was just this irritation right in your gut. all the time. And it makes total sense to me that that would be sending a signal to your brain that's just a constant loop, that something's wrong, something's wrong, what's wrong, doom is coming, you know. And if that is just removed, I looked up to see if it was part of the vagus nerve because I thought it might interact with that, but I guess it receives fibers from it, but it's not really part of it. I don't fully understand, you know, what the function is. And by the way, one of my questions that people on the MALS Pals website or Facebook group couldn't quite answer was that, you know, if you take the celiac ganglion and that apparently innervates all these organs, how do these organs function when you take it out? And, you know, someone did say that those viscera also have other innervators, and that makes sense. But what the doctor described to me is that what the celiac plexus does is mostly interacts with the autonomic nervous system. It doesn't control muscle or action so much. So it's basically just, you know, your autonomic nervous system controls things like sweating and breathing and certain signals. So he said it should be absolutely no problem. Like, my liver will still work even after it was attached to the side of the bed. Overall, I hold this entire surgical process in a state of wonder. Like, the absolute wizardry of the technical skill, the incredibly finely detailed of the anatomy. And, you know, if you look at this anatomy in books, it is like these tiny little fibrils that are all interwoven and interconnected. I don't know how anybody goes in there and figures out what to cut and what not to cut, and how you come out of there with like your aorta intact. I'm just in awe of the skill of the team and their willingness to kind of go into this, because this is not a surgery that anyone has done thousands of. My dad is having hip surgery right now, as far as I know, this minute. His heart surgeon has done, I think, I can't remember if it's 5,000 or 15,000. Like, he has done thousands of hip replacements. And my dad's like, you know, that's what you need. And I'm like, that is not possible. I'm sorry, but there is just no one who's done that. So I really appreciate people being willing to take that chance, knowing that there are risks for them as well. So, you know, I'm sure when you're in there with a piece of instrument, nothing looks like in the pictures. Even like in the pictures, at least they have different colors, but when you're inside the body, I think they all just look kind of like pale yellow, right? They also said that they removed some inflamed lymph nodes, and I'm curious to ask the doctor more about that. I have so many questions, but I wanted to post this to let you all know that it's okay to have a little anxiety about any of these surgeries, and you will also be okay after them. Only a week out, and I am sitting up. I'm preparing meals. I do have to lay down frequently. I did some weeding, some gardening yesterday. I'm speaking to people on Zoom and on the phone. I still have like a deep ache in here, and I am not running any marathons. I am taking it easy with a big E. But, you know, I feel like I had a relatively easy time of it, considering other people I know who've had this surgery and they've had other complications, people who've had it open, or have had other complicating factors or had multiple surgeries at once. So that's been my experience. I'm sorry it's so long, but I know people are really hungry for information, and I wanted to share what I had this past week and how it worked for me. I will check in later. Let me know if you have any questions.